Hey, it's Dr. Guy, the Face Guy here. Want to talk to you a little bit about getting the most out of your consult and what can be done. So, when it comes time for a consultation, whether it's with me or any surgeon, things that are very helpful to know is medical history, what medications you're taking. So, you might want to go and look at a list. Even stuff that is over the counter, you may not think is a big deal, can be important for us to know. It's also important to know. If you've had any procedures done before, so surgical procedures on the face, and even some things that you may not even think about. If you've had Sculptra, other biostimulatory products injected, filler can sometimes be important. Energy devices, radiofrequency microneedling, threads, all those things play a part in maybe our approach and how we're going to go about doing a surgery, how much time we may need. They can affect tissue planes. So all that stuff is very important. But also very important is knowing what your concern is. What is your goal? What are you trying to achieve? For some people, that's real easy. They may say, hey, I feel tired. I look tired, or I got too much skin on my eyelids, or I got too much skin underneath my neck. Other people, it might be a little bit more difficult for them to put their finger on. And if that's the case, we can certainly kind of help guide you if you're saying, hey, I just want to look a little bit more refreshed. What can be done? The way the consultation works with us is typically we have a portal, and if you can put in those medications that you're taking, fill out your medical history, all that stuff will just streamline it when you actually come in person for your consultation. But what we do is we would go over that medical history with you, make sure there's not a history of any kind of abnormal scarring, bleeding disorders, maybe there was a problem with a previous surgery, those kind of things. It's all going to be important. But we take some photos while you're here, and then I'll come in, I'll look at the photos, I'll do my exam, we'll assess the tissue, talk about your concerns and what can be done, and we'll come up with the treatment plan for you. And then we'll go ahead and we'll give you that quote and kind of go over that. Now, we do have a lot of virtual consults that we do. And so to get the most out of that, what is very helpful is if you could take some photos and send them in beforehand. And typically the photos we're looking for would be something straight on, 45-degree angles, and then from the side. Usually the ones from the side, you're going to need somebody to help you out on that. If you just try to turn your head, it doesn't give us quite the angle. It can affect the neck and how that looks. And so if you can have somebody actually take those pictures, it can be beneficial. And then when we do the video virtual exam, we'll do our best to kind of assess tissues and those things. But if you have some questions about surgery, we'd love to sit down and talk with you.